Hi again. Let's go ahead and continue this. Okay, so hepatitis. These are just some general labs and diagnostics. So white blood cells can be low, they can be normal. Just in general, remember it is a virus. A urinalysis, there could be some proteins in the urine, bilirubin in the urine. Remember, this is indicative that something's going on with the liver because there's too much bilirubin traveling around in the blood. Remember, the liver makes albumin, so hence those could be leaking out and be in the urine. An elevated AST and ALT, generally high. So these are enzymes that leak into the blood when the liver cells are damaged for whatever reason that the liver cells would be damaged, and certainly hepatitis would be one of them. Generally, the the ALT, which is higher. Yeah, this is generally a little bit higher. But these are high, like these are very high. They're not just, 50 and 100. They are often greater than 1,000 and can be up to 2,000. So those are generally going to be high. Again, albumins and proteins and bilirubins can be high. Alk phosphatase is another enzyme that is secreted when there is generally a problem in the biliary ducting. So the common bile duct, the hepatic duct, those types of things. So this is just a general type of a lab value that can give you an indication that that biliary system, there's something going on in there. Is it the gallbladder? Is it the liver? And also it can be increased when there's any type of bone issues, bone cancer or something, and then there can be further testing after that. So an IgM and an IgG, so immunoglobulin M or IgM antibodies are produced against an antigen in the early stages of infection and are detectable for a few days afterwards. Okay, so they're detectable for a short while afterwards. That's the main thing to know. So IgM occurs early. Immunoglobulin G or IgG antibodies are produced 7 to 14 days after the infection and are detected for months or even years afterwards. So IgG is often indicative that not of a current infection, early stages, but it can be indicative that this person has had an infection. It's an older infection. The infection is gone. And we're going to talk about both of these, and those are just two general kind of things to remember about IgM being somebody taught me once, and it kind of does help me. IgM, immediate, that we see these pretty much immediately or early. IgG, the infection is G, gone. It was in the past. So let's talk about serology, and first we'll break it down, hepatitis A, B, and C. So hepatitis A, we have an anti-HIV, so hepatitis A virus, which is an antibody for hepatitis A virus, and IgM, which is the same thing, antibody for hepatitis virus, IgM, which implies, we just talked about it, this antibody for hepatitis A virus is IgM and implies a recent infection. It peaks during the first week of illness and disappears in 3 to 6 months, which are diagnostic of acute hepatitis, which says something a little bit different here. Now that I'm seeing it. So actually IgM is a little more detectable a little bit longer, but what you need to know is it's early on. And IgM is an excellent diagnostic test for hepatitis A. IgG, also an antibody to hepatitis A virus, implies previous exposure and confers immunity. So basically, if this is positive, It if the IgG is positive, it confers that the person had an infection and that they're immune. Presence of IgG alone is not diagnostic of an acute hepatitis A infection. It indicates previous exposure, non-infectivity, and immunity to a recurring HIV infection. Okay, those are the important things to know. Recent, previous exposure, not diagnostic of an acute hepatitis, very diagnostic of acute hepatitis. So just in summary, an active hepatitis A, the antibody for hepatitis A, IgM is present. A recovered hepatitis A, an antibody to HIV, which would be specifically the IgG, would be present for recovered. Simple, right? That one's pretty easy. Here's where it gets a little bit complicated. It's complicated in high yield. When we talk about the serology for hepatitis B, I'll try to keep it as simple as I can and point out the main things that I want you to know. So hepatitis B, again, is very common worldwide, not necessarily, I mean, it's common, but worldwide, when you take, all the countries, it's something that we see. And definitely with a lot of immigrants and stuff, we're going to certainly see more hepatitis B. We're going to talk about the hepatitis B antibodies and antigens. So I got to know the difference, right? So an antigen is a pathogen. It's an infection. An antibody is when the body builds an antibody against that specific antigen. So obviously that's something that would be important to know. So let's start here. Hepatitis B surface antigen. Okay, that's what we want to talk about, because when we talk about a surface antigen, we call it HBsAg, is the first evidence of a hepatitis B infection. So we draw an HBsAg, and that says you have a positive surface antigen to hepatitis B. If you have a positive antigen to hepatitis B, you got hepatitis. Now, there's going to be two different ones we're going to talk about. We're going to talk about, well, not really the antigens. There's two different antibodies, but just keep in mind it's called an HBsAg. Hepatitis B surface antigen is the first evidence of hepatitis B infection, and will remain positive in asymptomatic carriers and chronic hepatitis B patients. Okay, so it can indicate chronic or active infection, but we need further workup. Okay, so this means that there was a chronic infection or there's an active infection. So we need to do a little bit more testing. You need more workup when somebody has a positive HBsAg. So write that down. After somebody has a vaccine, they will be positive for the hepatitis B surface antibody. The surface antibody, the antibody against HBsAg. When you get the hepatitis vaccine, when you got your series of 3, they're basically giving you a lot of this antigen right here. That's what the hepatitis B vaccine is made up mostly of HBsAg. So you have a positive, you build an antibody to it and it becomes positive. So that's how we know somebody is immune to hepatitis B, because their hepatitis B surface antibody is positive. Got to know that. Okay, so now we'll get a little bit deeper in here. The next one here is hepatitis B core antibody, or the antibody to hepatitis core. Hepatitis B core antibody. Okay. And IgM appears shortly, we just talked about IgM, after HBsAg disappears and before the antibody to the core, antibiotic specifically to HBsAg, appears. So this core antibody and IgM, this antibody and IgM appears shortly after the antigen disappears and before the antibody appears. okay? The antibody for the surface antigen. You get this core antibody, so it's just another antibody. Okay, so, all right, so let me just leave it at that, okay? So the next thing is hepatitis B E antigen, okay? Hepatitis B E antigen is helpful. Let me just tell you something about the core. The core is often not routinely drawn. This is what is routinely drawn. Okay, this right here is routinely drawn. But to determine where somebody is in their hepatitis, if it's acute or if it's in the past or something, we're going to draw a core antibody. So the HBE, a protein derived from hepatitis B virus core, and it indicates circulating hepatitis B virus and highly infectious serum. That's it right there. Highly infectious serum. So this HBE antigen, E, is found only in HBsAg positive serum, and the presence indication, it indicates that there's viral replication going on and infectivity. Okay, so this is highly infectious. When somebody has a positive hepatitis B E antigen, they are viral replicating and have highly infectious serum. Well, that's pretty clear, right? That one kind of stands alone. The antibody to HBE often appears after the antigen disappears, and the antibody to HBE signifies diminished viral replication and decreased infectivity. So these two go together right here, which makes sense. These two go together right here. That makes sense. And the core stands alone and has its own little meeting right here. So if somebody has a positive HBsAg right here, that confirms immunity against hepatitis B. That's almost always a test question in certification. How do you know if somebody has immunity against hepatitis B? We draw an HBsAg right here. So let's take a look at this summary. Hopefully this isn't too confusing. Active hepatitis B. So there's some variables in here, but just some kind of main things to keep in mind, just to be able to answer some test questions and kind of understand a little bit about what's going on with this, with hepatitis B. As far as the serology, we get hepatitis B, HBsAg. Okay, that's the first evidence of a hepatitis B infection. The HBeAg, right, that's going to be positive because that's an indication that there is some replication and then this person's infected. An anti-HBC, which is the hepatitis B core, which is going to appear after somebody has an infection. And we know that active is going to have an IgM. So we're going to see an IgM in active hepatitis. Chronic hepatitis B, we're going to see HBsAg, okay, because it's evidence of a hepatitis B infection. An anti-HBC, which is a core antibody. And a core antibody you're going to see is indicative, core is indicative that somebody has had hepatitis or they have chronic hepatitis. This lasts for a long time. So if somebody has a core antibody that is high, it's indicative that they have a chronic infection or a previous infection. And I'll show you a chart and you can see that just lasts for a really long time. An antibody against HBE, okay, for a chronic infection because it's an antibody against the HEB antigen. They build an antibody for that, a chronic infection. Their IgM could still be up. This is can or may not be up, but now here they have an IgG, right? it's either in the past or it's just a chronic infection, long term. Okay, so I said IgG is gone. The acute infection is gone, but the IgG is up for a chronic infection, and it could mean that somebody had an acute infection in the past. So just kind of keep the main concept in mind to kind of help you. Recovered hepatitis B, anti-HB core is high. So the core appears when somebody has a core antibody, which we don't generally test, but sometimes it'll be tested. Sometimes they get accidentally tested. They do a core antibody instead of a surface antibody. But when their core antibody is up, it's an indication that they have had hepatitis B, right? They have chronic hepatitis or recovered hepatitis when the core is up. And an antibody to hepatitis B surface antigen, which is the HBsAg. So an antibody to HBsAg, you can write right here, is HBsAg. And that's an indication that they have had the antibody to hepatitis B. Ugh, tough one. So this is just a little bit of a, maybe will help just kind of take a look at it in a different way. I'm sorry, I don't know why this looks so blurred. I just noticed this. That if you give somebody, hepatitis, somebody acute hepatitis B virus infection with recovery, a typical serologic course. Hepatitis C antigen occurs, okay, right here. So HBsAg peaks. This would be with the infection or the vaccine right here. IgM, immediate, okay, that peaks with the HBsAg, and then an antibody to the core. The core antibody starts to develop as well. Only really in a virus, they don't get this core antibody in the vaccine, because remember, the vaccine's all this HBsAg. Then there is this window period right here, which can be an indication. Like sometimes if we draw blood during this window period, nothing is detectable, because as this HBsAg goes up, this antibodies to the HBsAg, to the hepatitis B antigen, the antibodies start to be made, and they start pairing itself, right? Connecting to each other to help get rid of the virus. And sometimes they balance each other out, and there can be like this little window period right here. And then what happens is you'll start seeing the surface antigen go down and the surface antibody going up. Then the antibody becomes higher than the antigen, and the antibody begins to increase and stays up for many years. This green right here is the core antibody. When somebody has an infection, this is an indication that somebody has a chronic infection or they had an infection in the past, the core. When somebody gets a vaccine, this doesn't happen. They only get the surface antibody. The core is an indication that somebody has a chronic infection or an infection in the past. Okay, and then this right here is the E antigen. Remember, this is an indication that somebody has the presence of the virus, and it's circulating, highly infectious, and then they get the antibody to the HBe, and this antibody to the HBe stays for a long time. This is when the virus is occurring and very active. We have the HBe antigen. Okay, this is something else I just kind of want to go over. Interpreting hepatitis B blood test results. So again, they can mean a couple different things. So keep in mind the main concepts I told you about all of them. Don't get into memorizing minutia, and you're going to get confused. Keep the main concepts of each one of them, and you'll be able to answer all the questions. So what if somebody gets some HBsAg, HBsAb, and then the core? So the surface antibody, the core antibody, and then the surface antigen. Okay, so if you don't know what these three things are, you need to go back and listen to what I just said. If somebody has a negative HBsAg, a negative HBsA, or excuse me, I'm sorry, Ag antigen, a negative HBsAg antibody, and a negative core, they're not immune, they're not protected. So a negative HBsAg, everything negative, patient has not been infected because there's no core, but still is at risk for getting one, and they need an vaccine because look, they don't have any antibody in their body. They would, if their vaccine is active, they're still immune because of their vaccine, this would be positive. If they're immune because they had the disease or have chronic, this would be positive. Negative, 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 they get to have the vaccine. If somebody has a positive antibody to surface antibody and a positive core antibody, immune controlled, they do not need a vaccine. Surface antibodies are present due to a natural infection, has recovered from a prior hepatitis B infection, and they can't infect others. So it's an indication that they have the antibodies. Generally, the core is a previous infection. This SAB, this can be a previous infection as well, or the vaccine. But regardless, you see this person has immunity. No vaccine. So immune protected, no vaccine is needed, has been vaccinated, HBsAg is positive, does not have the virus, and never had the virus. Never had the virus, does not have the virus, never had the virus. This person looks like they did have recovered from something. But their antibody to the surface antigen is positive. Great. That's what we should see when somebody has the vaccine. This is what you should see unless you've actually had hepatitis. You can have them both positive like that. Somebody's infected. Positive HBsAg indicates hepatitis B virus is present. Okay, that's what we need to go for. Then there's definitely going to need to be some more testing done, but that's an indication that hepatitis is present. Virus can spread to others. Find a doctor who's knowledgeable, get more of an evaluation. More testing is needed. Period. HBsAg is positive. Here we have somebody who has a core antibody who's positive, but they don't have the antigen and their surface antibody is negative. So this is just a little bit unclear. This is an indication possibly, result is unclear, possible past or current hepatitis infection. Because the core, that's an indication, well, maybe this person actually did have a previous infection. Do they have a current infection? There just needs to be a little bit more testing done. Okay, I hope that helps a little bit. And the good news is hepatitis C, chronic, remember chronic, 90% of IV drug users will develop chronic hepatitis. Many hepatitis C develops into chronic, develops into cancer. These people can be asymptomatic. That's kind of a problem. But a PCR confirms hepatitis C infection, period. That's all you need to know. Okay, for hepatitis, or the hepatitis C viral RNA would be picked up with this PCR right here. The last slide I want to go over is some general management. So generally supportive, rest during active phase. Well, that's just going to be depending, right? So generally supportive, it's hepatitis A, for sure. If they have hepatitis B or C and they haven't progressed into like hepatic encephalopathy and they don't need to be hospitalized, they just need to be bed rest, resting, that kind of thing, increasing fluids just to kind of help get the toxins out of their body, avoid alcohol and any medications that are detoxified in the liver. No or low protein diet. Again, they have albumin leaking out of their liver. Vitamin K, if their pro time is long, vitamin K is made in the liver. So hence, these liver patients, if you've taken care of, a chronic liver patient, they are bleeders because they never make vitamin K. So if their PT is long, we go ahead and give them vitamin K. Lactulose, if you have worked in the hospital, you know what lactulose is. So always test questions on lactulose, either PO or PR. If there's elevated ammonia levels, which will obviously lead to hepatic encephalopathy. And that's certainly a treatment that you need to know what that is. A paracentesis, if somebody has ascites, and generally what dictates a paracentesis is if that ascites on the belly gets so abundant that it presses on their lungs and they become short of breath. Liver transplant if they're in end-stage liver disease. Vaccines are the cornerstone for prevention. Make sure you know that A and B both have a vaccine. Prevention also includes limiting exposure to the virus, so lifestyle choices become important. No method of destroying the virus. Hepatitis A and E, remember these are transferred through the oral fecal route, usually resolve with no treatment. Can be very serious for a pregnant woman. Nobody can get D unless they have B, so prevent yourself from getting B. Other types of viral hepatitis can be treated with interferon injections, antiviral medications. So there definitely are viral treatments. This is the point of this lecture. So there certainly are multiple antiviral medications. And Barkley does go over quite a few of them, but that's just not anything that I would be testing you on. That is just very specific. Just know that that's a treatment plan for anyone. Thank you.